Healthcare finances in the United States. The U.S. healthcare system is financed by government-sponsored programs, private health insurance, and out-of-pocket payments. Medicare and Medicaid are the two largest government health insurance programs in the U.S. and have provided increased access to healthcare for many individuals. Medicare provides medical care for those over 65 years of age and to disabled individuals entitled to Social Security benefits. Medicaid provides health insurance to the impoverished population and is administered by individual states. The Children's Health Insurance Program provides health coverage to eligible children. Each state offers CHIP coverage and works closely with its state medical program. The Veterans Health Administration provides care to over 9 million veterans enrolled in the VA healthcare program. TRICARE provides medical services to active duty and retired members of the armed forces, and Indian Health Service is responsible for providing direct medical and health services for American Indians and Alaska Natives. As opposed to government-funded programs, private health insurance is marketed by the private health industry. The majority of Americans who have health insurance obtain it through employment. These group health insurance plans are the primary source of payment of healthcare services in the U.S. Individuals who are self-employed may purchase individual private health insurance. Premiums, deductibles, and copays tend to be higher with this type of plan. Indemnity plans, also known as fee-for-service plans, cost more than HMOs and PPOs but provide freedom and flexibility, allowing the individual to choose a doctor, healthcare professional, or hospital of their choice. HMOs and PPOs require an individual to choose a provider within the established network.